हेलो फ्रेंड्स, मैं डॉक्टर शफाली अग्रवाल। मैंने अपने पहले वीडियो में आपको एलर्जिक राइनाइटिस के बारे में बताया। व्हाट इज एलर्जिक राइनाइटिस? इट इज an allergic response to a specific allergen. When our body comes into contact with any allergen, it releases a natural chemical which is called histamine. It defends our body against these allergens and causes the symptoms of allergic rhinitis. These can be itching or the watering of nose, itching or the watering of eyes, sneezing and the sore throat. Some factors that increases your symptoms of allergic rhinitis are cigarette smoking, chemicals, perfumes, air pollution, humidity and the cold temperature. Now, who are at high risk of getting the symptoms of these allergic rhinitis? However, it can affect anyone but the people who has a family history of this allergic rhinitis or a medical or a past history of asthma or atopic eczema are at high risk of carrying these symptoms of allergic rhinitis. Now, what are the measures we can take to prevent the symptoms of allergic rhinitis? So these can be always wear the sunglasses while going out to protect your eyes from the pollen. Wash your beddings and pillows regularly. Always use a wet cloth for dusting or you can use a vacuum cleaner. If you have a pet, wash them or groom them regularly. You can also wear a wet cloth around your nose and the mouth while going out, particularly in the morning and in the evening, to protect from the pollens. The medicines I have already told you are given in the cases of allergic rhinitis is the tuberculinum, bacillinum, R-thiode, histamine, allium cepa and the sabedilla. The other common condition which resembles the allergic rhinitis is the common cold. But it is generally caused by the virus. And the rhinovirus is the most common cause of this upper respiratory tract infection. This upper respiratory tract infection is most common in the children because they wash their hands less frequently, put their fingers in their mouth more often, are mostly around the children who may be carrying these viruses. How this virus is spread? The mode of spreads can be either through the droplets in the air, by the person who coughs or sneezes without covering their mouth. Second, it can be spread either through the hands to hand contact, such as handshakes or hugs, by touching contaminated surface, such as toys and the utensils. The symptoms of this common cold are sneezing or the watering of eyes, sneezing or the watering of nose, sore throat, and the sometimes headache, body ache or fatigue, and the low grade fever can also be present in the conditions of common cold. In the common cold, we generally advise the patient to take a plenty of fluids. Plenty of fluids and the plenty of rest is advisable for the conditions of the common cold. Give them citrus fruits to increase their immunity. You can also do the salt water gargles at home. Now, the medicines that we give in homeopathy are generally given according to the symptoms. So, the medicines that come in these cases of common cold is the aconite. Aconite comes when the patient wakes up with a dry, croupy cough at night. And it is generally given in first 24 hours of the onset of symptom. It is given in 200 potency repeatedly. The second medicine that comes is the arsenic album. It is generally given in 30th potency. Here the patient takes cold from either eating cold or getting cold. Stuffy nose is present with the sneezing, and the anxiety and restlessness is marked in the arsenic album patients. He wants a 2-3 sips of water frequently. Means a small quantity of water is taken at a small interval in arsenic album patients. The third medicine that comes in excessive irritating discharge from the nose, and the patient is worse in the warm room and towards evening, but he feels better in the open air. We give allium cepa. It is generally given in 30th or 200 potency. Nitramur is given where the thin watery discharge is present from the nose, like the white of an egg. The Nitramur patient has a craving for salt, and excessive perspiration is present from these palms and the soles. Now, the echinacea is 3x or the 6x can be given to increase the immunity in such cases who has the susceptibility to catch cold easily. And minostium is another product which has echinacea in it. It's a WSI product which can be taken 3 or 4 times. 4 globules can be taken 3 or 4 times a day to increase the immunity in kids. So if you like my video, don't forget to subscribe my channel. I'll be back with more videos on diseases and their homeopathic treatment.